Headache and migraine are conditions which are similar in the fact that they result in symptoms which are perceived as one, which is that of headache, but they are different in a way that they are caused by different conditions. Headache can have different causes. It can be a simple headache, or it can be a headache which, unfortunately, in some patients may involve more serious disorders like a tumor in the brain. However, migraine is a completely different condition. Migraine is a condition that happens as a result of a particular type of headache. Although the exact cause for that is not known, it is as a result of changes in blood vessels and chemicals and nerves in the brain. Migraine is that type of headache where it can occasionally, however reassuringly quite rarely, result in conditions which can herald or warn us about more serious conditions. In terms of how migraine can get serious would be a patient experiencing symptoms not just of headaches, but also associated symptoms with problems with their vision or fainting spells or weakness in their arm. And sometimes it can herald the onset of a stroke, which is when migraine can appear like something more concerning. Migraine normally is fundamentally a condition which is a long-term condition. And usually migraines, apart from headaches, may be associated with, say, weakness or dizziness, in some cases, loss of balance, tingling, numbness. However, it becomes a serious problem if it is associated with what we call red flags or a secondary headache, when patients get increase in the pressure in their brain, and they can present with loss of consciousness or seizures or fitting, or more seriously, a stroke, which is when it becomes a medical problem and patients are advised to seek urgent medical attention. But thankfully, that is rare in cases of migraine. Migraine causes have been studied for a very long time, and though the specific causes for migraine are unknown, within the brain, it is understood that there are certain changes that happens in the blood vessels. They tend to what we call dilate, as an increase in size, increase flow. Then there are chemical changes around them and the nerve, which results in symptoms of migraine. And there are certain risk factors associated with migraine, which tend to exacerbate or increase the suffering from migraine. In some cases, genetic connection has been found, so migraine sometimes may be common in families as well. There are certain risk factors associated with migraines. It is often found if patients tend to miss meals. Sometimes it is seen when patients do not get adequate sleep, or sometimes even excessive sleep. Stress is known to increase migraine, as well as smoking. In some cases of depression and anxiety, migraine can be exacerbated. Drinking too much alcohol or caffeine can also result in migraine. Usually, sudden loud noises or flashes of light can also induce migraine and can be a risk factor. Certain types of food are also known to cause migraine, for example, excessive cheese or certain types of wine. In terms of how it can be prevented, patients of migraine need to be educated, and most of the patients of migraines, they understand what is a premonition or an aura before they get an attack of migraine. And if they understand their trigger for a migraine, for example, excessive alcohol or lack of sleep, then they are advised to recognize those and then try and avoid those. For example, not being hungry or not consuming too much alcohol, generally recognizing the triggers and doing everything possible to mitigate them. Migraines need to be treated in two ways. Migraines can present as an acute attack, so which is acute, sudden, and extremely important to attend to. And when this happens, it's advised that they take simple painkillers which are available over the counter and may not need prescription. For example, paracetamol, aspirin, ibuprofen, being mindful that aspirin and ibuprofen can cause gastritis, in which case they can take an antacid or a medication from their GP that can reduce the gastric acidity or stomach acidity. In terms of it's chronic treatment, or what is called a preventative treatment, or long-term treatment. There are various types of medications that are used. One of the groups that we use is called triptans, for example, sumatriptan, solmitriptan. They can be also put under the tongue for quick relief. Then there are some reserve medications which are prescribed by specialists like me. So if a patient gets diagnosed, it's advised that they see a pain specialist like me. For example, headache is my interest, so I'm able to help them. When patients use triptans, they're advised to understand and appreciate certain side effects like warm sensation, tightness, tingling, and flushing in their face. Usually, migraine is associated with nausea and vomiting, so it is advised that patients take some anti-sickness medications. Combination medicines work well, so a combination of a painkiller and anti-sickness medications. There are some non-medication approaches as well, for example, acupuncture. Some centers also do treatment called transcranial magnetic stimulation, where a device is put on their head, which is a non-invasive treatment. And last but not the least, some patients require Botox treatment, something that I also do. It is also recognized that migraine suffering can increase during pregnancy, but patients have to be quite mindful about what medications they take during pregnancy or breastfeeding.